The Olympic athletes, because they are in the spotlight and everybody's watching them on TV, that's where kinesiotape and other modalities such as cupping, you see the cool stuff on the Olympic athletes, and then that helps the public kind of learn what that is and learn, hey, would this be good for me? And then that's where the physical therapist comes in to help the patient interpret these different modalities that can be used and see if it's applicable, to help them with their issue.
So kinesiotape is a really neat tool that many physical therapists utilize in daily clinical practice, and there's a lot of theories as to how it works, but our research was evaluating the effects of kinesiotape in folks with shoulder pain. And what was particularly novel about the study that we published was looking at the treatment fidelity of kinesiotaping. And what that just means is the consistency and the continuity in how kinesiotape is applied. And what we found is that while kinesiotape seemed to be effective in folks with shoulder pain, the way that the kinesiotape was applied in the different studies was very different. And there's this lack of standardization in how kinesiotape is applied, which concerns us as researchers, because as researchers we try to standardize the way we apply interventions to the best of our ability, and when we evaluate the literature and we see all these differences, it just suggests that there's inconsistencies in the literature.
I did some research with some students, and specifically we were looking at using a piece of tape along the outer hip into the knee to see if the application of the tape would help the muscles in the posterior aspect of the hip, including the gluteal muscle group, to see if that tape would actually help facilitate the muscle contractions and improve the performance of a single leg squat. Sometimes when people go to squat, their knees may kind of angle in a little bit, and that's usually due to some weakness in the posterior hip. So we wanted to see if the tape would be effective in improving the squat mechanics. And what we found was the tape did not actually improve the squat mechanics for this particular study. That doesn't necessarily mean that it's not useful technique at all, but we just wanted to investigate that to see if, would that tape give some muscular facilitation and give some more cueing to the brain to maybe turn those muscles on. But in this particular study, it wasn't found to be effective.
For our particular study, we just focused on the shoulder, so we just wanted to look at that area. So we didn't have an opportunity for this particular study to review the literature in other areas. And while there is always conflicting evidence out there, there is a general trend to suggest that there is some value to kinesiotape in other parts of the body as well.
But I think, a lot of people enjoy it. People enjoy the bright colors. They enjoy the potential, I think sometimes it's attention getting. They can get attention for like what's going on. But I don't think anything other than what we found was really exciting or different.
I think that based on our published study and our systematic review, physical therapists can be confident and patients can be confident that kinesiotape seems to have a therapeutic effect. However, when clinicians are applying kinesiotape, I would encourage them to think about standardizing the method and how they approach it to the best of their ability. That way they can hopefully see more consistent outcomes.
If there's a piece of actual physical benefit and a piece of psychological benefit, I'm happy with that, because the end goal is decrease in pain and improvement in function and quality of life.